The federal government is hiking Medicare premiums with the announcement Friday that Part B premiums will shoot up by 14.5%. For more on this, we're joined on the KCBS Ring Central Newsline by Paul Seegert, managing partner at Healthcare Benefits at the firm PCS Advisers. Paul, thanks for joining us. And I guess the first question is, what's behind the premium hike?
Well, they're saying that there's some anticipation that there'll be added cost to Part B from some expensive new treatments. Aduhelm is a new Alzheimer's drug, and which in and of itself is, to me, a very interesting conversation. It's not been shown to cure or slow the development of Alzheimer's, and yet it has a very high ticket price, depending on how you look at it, $50,000 to $100,000 per person that gets the drug. So they were projecting a 7% increase in Part B premiums, and they're now coming out with a 14.5% increase, with some anticipation that they may approve use of that drug.
I think some of us are confused by the Medicare parts. There's Part C and there's Part D, and there's what is
Right.
Part B?
Part B is for outpatient services, and the reason that Aduhelm, this Alzheimer's drug, would fall under Part B is because it's given as an infusion in your doctor's office. So it's not an inpatient treatment that you would get while staying overnight at the hospital. It doesn't fall under your Part D, which would be your normal prescription drugs that you might get at the pharmacy. So it falls under Part B, which is going to go from, for the lower income level folks, $148 a month, around there, to about $170 a month with this increase, which is a noticeable amount for many of these people.
Especially if you're on a fixed income. So is there any relief from the federal government that comes along with that, or are you just out of luck?
Well, you're kind of out of luck. They're saying that the cost of living increase, the COLA, cost of living allowance that they're going to add of 5.9% to people's Social Security income this year will offset it. And it just depends what income bracket you're in. For some folks, it will more than offset the increase in their Part B premium. For the very smallest recipients of Social Security, it will not. But for many, it will. But then the other question is, why are they giving you the cost of living allowance increase? Inflation. And inflation is already going to offset that 5.9%. So I think it's not good news for the most part for any of the income brackets and those that are being affected.
You mentioned the Alzheimer's drug, the new Alzheimer's drug. Isn't Medicare famous for being able to negotiate drug prices down?
That's another great topic. We don't let Medicare, the largest purchaser of drugs in this country, we don't let Medicare negotiate directly with drug manufacturers. So they have said they're not going to offer that drug as of yet. But if they do, they're going to pay the full ticket price, which is $56,000 for the drug, plus other fees related to its delivery in the doctor's office and testing for other, possible side effects. So it's going to end up being a $100,000 ticket per person. And we have 6 million people, mostly on Medicare, who have Alzheimer's in this country. So it could be a massive increase in cost to the system.
Well, you're right in wondering about the efficacy of paying that much money for a drug that hasn't been proven to many medical professionals. I'm not just talking about us laymen. I'm talking about a lot of doctors say it's not been proven.
That's right. You have a group of 11 scientists that informed the FDA on whether they should approve a drug. 10 said no. 1 said, I'm not sure. They approved it anyway. And the FDA launched an investigation into their own employees who had irregular interactions with employees of the drug maker. And there's a lot of question around this. And then you have some very reputable medical groups around the country, Cleveland Clinic, Mount Sinai, New York. Some very reputable organizations, the VA, many Blue Cross Blue Shield companies around the country that all came out and said they will not cover it until there's more evidence that it actually is effective. And so I'm pretty surprised now that we're seeing Medicare, who had held out to this point, hike premiums in anticipation of covering it. It's a pretty big turn of events.
It sure is, and it's the topic of a whole other conversation. Paul Seegert with PCS Advisers, thanks for talking to us about this.